Up until recently, the trend was to make butts bigger. In fact, buttock augmentation has been one of the fastest growing plastic surgeries over the last 10 years. But today, it's the exact opposite. Let's get to the bottom of this over the next 3 minutes. Kim Kardashian has been given credit for almost single-handedly spearheading the BBL craze. BBL stands for Brazilian butt lift, and it's the most common way to make the butt bigger surgically. So let's take a peek at Kim Kardashian before, and now let's take a look at her now. Has her butt gotten smaller? Well, let's take a peek at her sister Khloe Kardashian before, and let's take a look at her now. Her butt looks like it's gotten smaller too. So what is going on? Where there appears to be a trend in Hollywood of reducing the size of the buttocks back to a more realistic size and shape. So how does this work? Well, it really depends on why the butt was so big to begin with. If the butt is large due to overall weight, then losing weight can definitely make the buttocks smaller. And it is true that both Khloe and Kim appear to have lost a significant amount of weight recently. If the person has buttock implants, then it is a pretty straightforward operation to remove the buttock implants and therefore make the butt smaller. And this is done by making an incision right between the butt cheeks vertically and then literally just pulling those implants out. Now, the resultant scar tissue pocket needs to be extensively cauterized to allow it to heal together so you don't have this big open pocket left over. A plastic drain is then placed into each butt cheek to remove any fluid that may accumulate there to once again allow the butt to heal back together. Another option is liposuction. If a person has large buttocks either due to weight gain, genetics, or a BBL surgery, the Brazilian butt lift where fat is injected into the buttocks to make it larger, then liposuctioning the buttocks can definitely make the buttocks smaller. But the big question with both of these operations, liposuction and removal of buttock implants, is what do you do with the loose skin left over? When you deflate the buttock skin isn't necessarily going to tighten up like you would like it to. In a younger person where the skin is tighter, then that skin can retract to an extent, but in an older person it can really sag. And this can give the person a flat, droopy butt afterwards, and it can even be so bad as to theoretically look like two pancakes. Now, the best way to lift a drooping butt is to perform a butt lift where the excess skin is cut out. The negative with this, though, is it does leave a lengthy scar all the way across the top of the buttocks. This scar is permanent and it can be very visible. So what happened to Kim and Khloe Kardashian's butts? Well, only they and their plastic surgeons know. But if you see them in the near future sporting a large tattoo covering the top of their buttocks like a tramp stamp, well, then we gotta assume that maybe they ended up getting buttock lifts performed. So how did Kim's butt get so big in the first place? Is it implants, BBL, or something else? Well, I cover what I think happened to Kim's butt to give her that legendary derriere that we all know about in this video right up here. You'll get the straight scoop in just 3 minutes. And remember, eat real food, use clean skincare, and only consider actual plastic surgery as a last resort.